Let's look at this sad but tragically common case scenario of a 68-year-old woman, previously fit, active and independent, enjoying the early years of retirement, presenting with all the signs of an acute stroke, and her emergency CT scan confirming a massive left-sided area of infarction with horrible midline shift, classic of an AF stroke. And AF is responsible for around a third of all strokes and has become established as the leading independent risk factor for stroke, increasing the risk by an average of 500%, much higher, for instance, than the risk associated with hypertension. AF detection is reassuringly a key component of our current NHS long-term plan and is identified as one of the biggest opportunities to save lives and prevent health inequality over the next decade. Frighteningly, it's now thought that 1 in 3 adults who reach the age of 55 will eventually develop AF in their lifetime. It must therefore become really routine primary care clinical practice to pick up these patients, and the burden of AF, we must also remember, will increase sharply in the coming years as the population continues to age. Although, as you can see from this graph, men have an overall higher prevalence of AF, you can also see that women tend to catch up in their later years. And we also know females have a higher stroke risk when they have AF, as highlighted in the CHADS-VASc scoring system. So sadly, our patient had a devastating outcome, likely now spending her last few weeks, possibly months, in a nursing home, not being able to speak, swallow, or move half her body, and is now wheelchair bound. A truly horrible outcome. And the tantalizing question I want us all to have in the back of our minds during this webinar is whether this horrible event could or should have been avoided, particularly with the use of some innovative technology that is now available.